right, so when it comes to treating IT band syndrome, we're primarily focused on two things. Treating some of the soft tissues around the IT band, ranging from the knee up to the hip, as well as making sure that the hip joint itself can move as it needs to, so that there's not restriction there that's possibly kind of putting the knee in a bad position. So one of the things that we typically focus on are all of the muscles or soft tissues that the IT band connects to, going from the hip all the way down to the knee. So we usually start with the TFL and some of the lateral gluteal muscles here, and we usually use a little bit of a pin and stretch technique. So I'm going to use my thumb here to be able to kind of contact that area, and then we have the patient go through the range of motion. So we pin that muscle while it's short. They bring the leg up and over and off the table as we pin that muscle to see if we can get that to release a bit, and then repeat for a couple different repetitions. This is nice because it helps to reduce the restrictions in the muscles in the glute, and it also helps to reduce tension on the IT band going all the way down the leg, and can help to relieve some of those symptoms. You can go ahead and come back. So we can do similar things to muscles on the lateral portion of the quad, just underneath the IT band, some of the muscles that run down the side of the leg, sometimes lateral hamstring, and occasionally we'll work a little bit into the calf as well. The other thing that we typically do, and I'll have you go face up, is again making sure that the hip is functioning as it needs to. So we'll take it through a little bit of range of motion to see if there's any restriction in internal or external rotation. If we find a restriction, we can do gentle mobilizations to see if we can restore that range of motion. And occasionally we'll even do a little bit of extremity chiropractic adjustments, where we'll take that leg and be able to distract and then adjust that hip to see if we can get it to have enough space to be able to move properly, and then take them into some of the rehab exercises to build strength with that new range of motion. So big things are reducing soft tissue restrictions and limitations, and then making sure that that joint can function, so that when they do get back to running, they're not making that same kind of fault with the knee crashing in, and then we can resolve the pain. So next video, we're going to talk about some of the exercises that we use directly following treatment that help to get people back on that path to doing what they enjoy.